come to collect you for your surgery, is that okay?
Right.
In the UK, some 3 million major operations are carried out every year.
Nice big deep breath. We'll look after you, don't worry.
Only the country's top surgeons are skilled enough to take on the most critical cases.
Cameron, you all right?
Just take a couple of deep breaths.
If you're going to make a hole in someone, you better be sure of what you're going to do.
Should we go for it? Right.
They're using pioneering techniques to treat conditions that used to kill.
A few years ago, these operations were felt to be too big or too dangerous.
But pushing the boundaries of modern medicine comes with great risk.
Just keep quiet for a second, please.
If I move the blade too much, she's going to wake up unable to breathe.
Life is precious. It can vanish in a heartbeat.
Whoa!
You need to keep your head.
Hold this. The heart is empty. We haven't got any volume at the top.
If you panic, the patient can bleed to death.
The surgeons bear the ultimate responsibility.
I need it ASAP. I can't wait for this.
I'm not infallible. Failure is absolutely possible.
We are a team, but there's one person's name at the top of the bed.
Bloody hell.
This is what really happens behind the closed doors of their operating theatres.
This is a battle, us versus the Grim Reaper. And we're not going to lose.
The Queen Elizabeth Hospital, Birmingham, is renowned for pioneering surgeries that can be risky, but if successful, truly life-changing. One of its leading surgeons is Navin Furtado, who specialises in correcting severe spinal deformities.
Spinal surgery is a risky specialty. We have to decide whether surgery is the right thing to do. There are scenarios where it's 50-50.
Right, to the left, to the left.
The debate about who is deserving of NHS money and NHS care is ongoing all the time. We have to balance risk versus benefit.
Navin is taking on one of his biggest cases to date. 63-year-old Chris Green.
Okay, you're pulling me screaming.
Years of heavy work as a butcher have taken their toll on Chris's back. He now struggles to walk or even stand up straight and relies almost entirely on his wife, Sandra.
I can spend up to 15 hours a day in bed, rarely go out the house, constantly in excruciating pain from the nerves in the back, radiating down my leg.
Chris's spine has become increasingly deformed over the years. The spinal column is a strong but flexible structure, built from 24 bones, known as vertebrae. Between each vertebra are discs which act as shock absorbers whenever the body moves. A normal spine is curved, but some of Chris's discs have worn away through excessive lifting and straining, causing his lower spine to collapse into a straight line, forcing his head and neck forward in front of his pelvis.
Imagine if you had to walk around all day, bend forward, as if you were trying to hold a walking stick, but you didn't have that stick to support you. Your body is not designed to be in that position. Pain is going to come from muscle, from ligament, and the joints itself.
I never expected this. I used to be pretty healthy and fit in my younger days. Not being able to do things you used to be able to do, it's depressing. Household chores, gardening, the whole lot falls onto the wife.
We've had 4 years of hell. Chris getting up, having a cup of tea, going back to bed. Getting up, having a cup of coffee, going back to bed. Coming down for a sandwich, going back to bed. That's no life for anybody.
When I first saw Chris, he was consigned to the fact that this is his life, this is his future. One of chronic pain management, strong doses of pain medication, therapy, adaptations to his house. All of that has a cost.
Chris has already undergone 3 surgeries, none of which have corrected the deformity or reduced his pain. Navin is planning a radical procedure that few surgeons would attempt, rebuilding Chris's entire spine.
Hello there. Hi, Christopher, how are you?
Not too bad.
A bit nervous?
Yes.
Okay. We're going to make a big incision in your back from your shoulder blade area right down to just above your bottom. He'd been seen by different consultants who'd felt that there was nothing else that they could offer him surgically. And we're going to remove part of the vertebra, part of that spinal bone from the back by taking out a wedge of bone. I thought, possibly there is something here to do, but to do it, you have to go big. And so the operation is going to bring you from this position to more an upright position. What we're going to do is essentially break his spine and reset it.
Navin will be operating within millimetres of Chris's spinal cord.
The risk is that we could damage nerves, worst case scenario, paralysing you from waist downwards. Okay. Has that been quite a lot to take in?
It's knocks you to your boots, as we say.
Yeah, it's a risk, but I'm hopeful that this will work. Yeah.
So.
Fingers crossed. Yeah. We've got. I've said to Chris that there's about a 70% chance of something going wrong around the time of surgery or in the first year. Probably looking at about 8 hours of surgery or so. You need to be confident in your own mind that the quality of life that you have at the moment is bad enough that you want to take on that risk. All right, Chris, take care.
Okay,
all right.
Thank you very much.
Nice to see you. All right, you take care. All right, bye now.
Thank you very much.
Okay.
Where before Dr. Furtado, I hadn't really got much of a future. So it took me less than about 10 seconds to make my mind up. There's always a chance that things may go wrong, but you've got to look at the wider picture and think, am I going to get better? You're in the hands of the surgeon. Dr. Furtado is the goalkeeper that's going to save that penalty shootout.
Navin will be carrying out Chris's operation in Theatre 20, where the surgical team are getting ready.
Okay, Mel. How are you doing? You okay?
Chris's operation is so complex that Navin has requested help from spinal surgeon Mel Granger.
Then you can start prepping.
Correction of spinal deformity is probably the biggest and most complicated surgery that we do within spines.
I think he's grateful for what we're trying and accepts the risks. Running out of options there.
There's always a little bit of anxiety with big operations like Chris's. You look forward to it, but you can't allow yourself to be distracted by anxieties. You've got to focus on the job in hand. Cheers, mate. Thanks.
As a butcher, it's almost like a surgeon. You use a knife to prepare beef or pork, but I don't know if a surgeon uses a chopper like a butcher does.
For Chris's surgery, Navin and Mel will be working alongside anaesthetist Khalid Hassan.
Little scratch there. When we anaesthetise patients, people think we just put them to sleep and then walk away.
Thank you. Welcome. Thank you.
Throughout the whole time that they're asleep, we are constantly monitoring all their vital functions and making sure that they're safe throughout the surgery. Okay, on 3, gently. 1, 2, 3.
The surgery is likely to take up to 8 hours. Chris will be lying face down throughout.
Okay, so we've got Christopher Green. Okay, he's for instrumented deformity correction. Yeah.
We're going to remove a wedge of bone out of the vertebra to get the angle we need to get in his lower spine. That's the bit that's going to lose a bit of blood.
Expected duration of surgery?
We're going to try and finish on time.
The aim of the surgery is to rebuild a curve in Chris's lower spine so he can stand up vertically rather than leaning forward. To do this, Navin and Mel will drill 23 screws along his spinal column. As they can't bend the spine, they'll need to break it by removing a 30-degree wedge of bone from one of the vertebrae. By closing this gap, Chris's spine will be realigned into a more natural curve. Metal rods will be attached to the screws, securing the corrected spine in its new position.
All right? Everyone happy enough?
Yep.
Okay, good. You ready?
Yep, everyone happy?
We're happy? Okay. Okay. Let's have the, you got the dilator then.
Navin and Mel's first task is to clear a path to Chris's spinal column by removing the tissue that surrounds his vertebrae.
Forceps, please.
Running through the center of the vertebrae is the spinal cord, responsible for all the movement in the body.
I remember the first time I saw a spinal cord and it just blew my mind.
So we'll expose the thoracic spine here.
Every second of every day, of every month, of every year, for the rest of your life. That thing transmits all the impulses from your brain down into your arms, legs and trunk. And the spinal cord, when you look at it, is about the width of your little finger.
Okay, let's get this retractor in there. So we've got to create basically a giant space for two nerves to go out.
During invasive surgery like Chris's, damaging the fragile spinal cord is a very real possibility.
Okay, so now moving down towards the lumbar spine.
The spinal cord and the nerves take some manipulation. They can accommodate for that. But a millimetre here, a millimetre there might make a difference in terms of whether the patient's walking or not.
Okay, so that's that first level essentially prepared.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
14 clinicians are needed to support Navin and Mel today. Twice as many as most routine procedures.
If you're doing operations on the spinal cord and spinal nerves, but you need a full team behind you to do it safely.
We're more than a football team.
Surgery of this sort is expensive. It is in the region of £20,000, £30,000. I've got to be pretty sure that what I'm offering is going to make a positive impact.
So far, so good.
Lulu, come on, baby. I've got a swollen abdomen. It's just gradually got bigger and bigger over the last 8 to 10 years or so. I've tried Weight Watchers, Slimming World, every diet, and they wouldn't do no trick because my lymph glands just, they've broke down in my body.
Judy has an extreme case of lymphedema, chronic swelling caused by a defect in the system, which helps fight infection and drain excess fluid from the body's tissue.
It's like carrying another person, and most of the time I'm on the bed, and just to take the weight off my legs because it's so painful.
Judy's lymphedema has caused a build-up of fluid at her waist. Gravity has taken over, and she's been left with a hugely distended abdomen, known as an apron.
Because if I go outside, it feels like everybody's looking at me and like whispering to each other people. So that's the reason why I don't go out very often. It's horrible. I feel like an alien.
Plastics consultant Sunil Thomas has taken on the task of removing Judy's apron.
The majority of the public perceive plastic surgery to be cosmetic work, but it's much more than that. If a person has an abnormality that is correctable and is adversely affecting their quality of life, That is where the motivation comes from my side. I was surprised that Judy could have gone through life with such an enormous problem.
Ooh.
I take on board the fact that it's not a clear-cut life and death operation, like in a trauma situation or, a cancer that needs to be removed. But at the same time, she's got significant difficulties with managing herself on a day-to-day basis with things that you and I take for granted. And it's only going to get worse.
Her apron, full of excess fluid and tissue, has left her housebound and unable to walk more than just a few steps.
Oh, that's it. I'm in.
So the journey begins.
The detachment of Judy's apron will be the largest ever attempted at the QE.
I think it'll be easy to look at her clinical photographs first. I mean, that photograph is about a year old, so it's slightly worse now. It's reaching right down to the ankle area. So you can see there's a lot of lymphedema there. The lymphatic channels which take fluid into the lymph glands get blocked, and you get collection of fluid which just keeps on increasing over time. And the belly button is actually at the level of the knee joint.
Managing the sheer weight and size of the apron in theatre will be difficult. But there's another challenge.
The most concerning thing for you doing surgery is these large blood vessels down here. They're quite chunky. They're much bigger than you would normally find in the soft tissues of the anterior abdominal wall.
2 blood vessels, which would have previously circulated blood in Judy's abdomen, have now grown into her apron.
That's a very chunky vein.
Very chunky vein coming down.
So it's a huge vein, and that's...
As the apron has got larger, so too have the blood vessels.
The easiest place to access is here.
They will have to be carefully severed and tied off before the apron can be removed.
Pretty large. And that's going to be the...
But that's really good to know pre-operatively so we can plan it, and it also gives me...
The risks of the operation are increased by Judy's size. Weight gain has exacerbated the lymphedema, but she can't diet the apron off. It has to be removed surgically.
Go on, that's it. Go back now. Okay?
Yep.
Although they're separated, Judy's husband Dave has been supporting her journey to potentially life-changing surgery.
It kind of grew in the background, if that makes sense. There you go. Is that okay?
Yeah.
You all right?
Yeah.
She used to go to all these slimming clubs, and although you could see the weight coming off her face and other parts of her body, the stomach never reduced. She doesn't like asking for help, but she had to in the end. She really couldn't manage on her own.
Obesity is actually been on the rise. And because of this, a lot of plastic surgeons are now having to deal with this issue. There may be some folk who would say that we should not be carrying out this kind of surgery, which may be a financial drain on the National Health Service. But as surgeons, we are here to help our patients, not to judge them. And that's why we took the Hippocratic Oath when we became doctors many years ago.
Mr. Thomas, God bless him. He's fought for me. I am so grateful.
So, Judy, how are you?
I'm fine. I'm fine. I'm glad I'm here now.
Here.
I've been on and off crying all day, and I want to cry now because I've seen you.
Oh dear.
I know I'm in the right hands.
So, you're happy with all
Cosmetic surgeries, including apronectomies, aren't routinely provided on the NHS.
In terms of the risks, initially her request for this procedure was rejected because the commissioning groups did not actually understand the gravity of her problems.
I've suffered long enough.
Okay.
I don't want to go on like this no more. No turning back now. I've signed my life away.
You can always change your mind, but I don't think you will.
I'm here now.
Okay.
It took Sunil a year to convince the commissioning groups that Judy's weight couldn't be managed until her apron was removed.
I was really pleased when we finally got the green light to go ahead with Judy's operation. At the same time, I was slightly apprehensive because the surgical challenges would be very difficult.
How many of these have been done?
She's the first. I'm not putting it correctly. We do a fair number of these procedures,
Yeah.
but not to this extent.
Great, brilliant, thank you.
Sunil will first make an incision at the top of Judy's apron, trying to remove as much tissue without piercing the abdominal wall that protects her muscles and internal organs. He'll then make an incision from underneath the apron, carefully severing and tying off the 2 large blood vessels, before finally lifting the apron free.
I've actually requested if it is possible for us to have 2 teams, one on each side, with an independent scrub nurse on each side. So I think we'll start at the top, depending on...
Sunil has asked senior plastic surgeon Suk Rayat to assist him.
The amount of tissue, it's the largest that I've ever come across, and I think it's the second largest recorded case in the literature.
A 15-strong surgical team has been recruited to grapple with the huge weight of tissue during the operation, which will take place in Theatre 19.
We're going to have a sweepstake on the way.
Wait.
Yeah.
55.
55?
Yes.
Okay. So Richard's 55.
When everyone's on high alert, a sweepstake, guess what the weight of this apron is going to be? Helps to diffuse the pressure.
Yeah, mine's 35. Half a small person.
I'd say 38.
I think he's going to be right.
Yeah.
It's not that we're being frivolous or we are disrespecting the patient in any way. It's just to improve the morale of the whole theatre team. It will be a challenge because of the intensity of this huge abdominal apron.
Okay, and your patient is? Judith. Any concerns anaesthetic side?
So cardiac-wise, you might lose a bit of volume. We've got 4 bloods cross-matched as well. So overall, she's a very high risk.
Okay.
I'm ready to go, ready to have it done. But deep down, I'm feeling a bit scared and frightened, still scared and frightened. I just want to get my life back. And it's hurtful. And I don't like it. I don't like what I've been called. I have to depend on other people and it's horrible. When I wake up, I want him to be there. Nobody else. Just Dave. We've been through a lot together. He's been my rock. Just to hold my hand and make sure everything's okay.
Knock, knock.
We've been separated for about a couple of years now. See you later. It's called Endless Arguments.
Take it.
I will.
I can remember the first time I saw her, yeah. I thought she's very pretty, very attractive. When somebody stays at home all day, so much bottled up emotion, and the first person that comes through the door obviously is going to take all the flack. I'll see you in a while.
All right then, see you in a bit.
Take care.
I will,
Good luck.
later.
I think maybe that led to our bust-up.
Hi, Judith. You all right? Don't worry.
Nice and slow, yeah?
Unlike most patients who are anaesthetised in a side room, Judy is taken straight into theatre. Her size means it is easier for the team to transfer her while still conscious onto a specially reinforced operating table.
Okay.
Yep.
One.
Well done.
Okay.
What you looking forward to doing the most?
Driving my Herbie. It's a VW Beetle.
Wow.
My Herbie.
I can't see any veins at the moment.
Overseeing Judy's anaesthetic today is Raj Rao.
Because it will be very deep. Just going to use ultrasound to look at your vein, okay?
Well done.
Her weight makes her a challenging patient for Raj to keep anaesthetised safely.
Have you got it?
Not yet. Obese patients do present with a set of challenges for us as anaesthetists. Because of the fat within the patient, it's difficult to get an IV access. Okay, sharp scratch coming. And also, putting a breathing tube into the windpipe itself is difficult because there's a lot of fat inside the oral cavity. But the main problem is obese patients cannot breathe while they are lying down because all the organs are pushed against the lungs. That means the ventilator is struggling too hard to breathe for her, which could be a problem for us.
You think it might be? So we need two people. What we're going to do is we're going to bend her knees. Raj, are you happy for us to get started, for us to begin? Okay, knife to skin at 10 past 12. Okay. Yep. Judy is a high-risk patient. So for me, the biggest step forward was Judy's agreement that she would be willing to take the risks that this procedure involved. Can I have a knife, please? And I think it's the wrong approach to make a decision presuming that things are going to go wrong. Liger clip. There was no question in my mind whether or not this was the right or the wrong decision. I think you make a decision on the presumption that things are going to go right.
In Theatre 20, former butcher Chris has also taken a decision to undergo risky surgery for the chance of a more active life and less pain.
So we're going to both put screws into 6 and then alternate below 7. Okay.
Before Navin and Mel break Chris's spine and rebuild it,
Self-retainer, yeah.
they'll insert 23 screws in his lower vertebrae. These screws provide attachment points for the metal rods that will ultimately fix his reshaped spine into its new position.
Okay, let's have X-ray in then. Can you get me the light lead gown? Yeah, the dog, the Dalmatian dog, or the boat one, the blue one, whichever.
Each step of the way, the team uses X-ray to guide and check their work, so protective lead gowns are worn throughout.
Can you just come over the top towards me a bit? And see that? That is S1, but it's higher than you think, Mel. Okay. So more towards you. Just come up north a sec.
The team will take around 60 X-rays to ensure they attach the screws in exactly the right position.
That is a big screw. So it's the biggest screw they have on the tray. There'll be a lot of stress going through the lower part of his spine.
Always in my mind, I've wanted to do something using my hands, essentially. So I was making Lego, Meccano, that sort of stuff as a kid.
And you've got the nibbler.
As surgeons, we like our toys.
Need 2 starters on this set. The instrumentation that we use in spines reminds me very much of the Meccano I used to have. I had set 8. I'm pretty sure I've still got it somewhere.
Generally bloody, isn't it? Very bloody.
Let's have a swab, please.
Another big swab, please.
Navin and Mel have now been operating on Chris for 4 hours.
Blood loss is substantial. I'm not entirely happy with them, actually, I must admit.
Starter, please.
If you're making a big cut from the top of his spine right down to his pelvis, that is a significant amount of blood loss.
He has been oozing quite a lot throughout the surgery.
His hemoglobin is very low, and with it, his blood pressure's just gone down.
When you do these osteotomies, when you break the spinal realignment, the bone bleeds. You produce blood in your bone. You put a patient face down, if they've got any pressure on their tummy, it will force the blood from the belly back into the spine. And so that can be a problem, both for the surgeon in terms of seeing what you're doing, but for the anaesthetist in terms of keeping up with blood loss.
Blood pressure's still heading south, isn't it?
Got another swab, please. 3 litres.
It's the job of anaesthetist Khaled to control Chris's blood levels.
Let's do one of my... When something like this occurs, for me personally, it starts to add to the stress level. You've got a pressure bag for this? Yeah. And one needs to stay focused to look after the patient.
In spinal surgery, the patient is particularly vulnerable.
If their spine is all exposed and open at the back, lying face down for 12 hours potentially, that's a very difficult position to resuscitate someone in.
Have you got much in your cell saver to go back to?
Not much in there.
The team is using a blood salvage machine. This collects Chris's own blood, washes it, and then returns it to his body. It should eliminate the need for donor blood.
Oh, fantastic.
But the blood salvage machine can't keep up with demand.
Correct.
Okay. Got a hematocrit of 19.
19?
19, 19.
That's a little low.
That's a bit low.
That's a bit low, okay.
There's 800 in the sucker, small amount of wash has been used, heavily blood-soaked swabs.
The average human body contains 5 litres of blood.
Ooh, crikey, O'Reilly, that is not right at all.
So we are going to need more room at the bottom end, aren't we? Yeah.
Anticipating blood loss is a science, an art, and a challenge. If we didn't manage the replacement of the blood, then after about a litre, they may already be running into very, very serious problems. We're probably about 1.2, 1.3 litres down. I think we're bled more than we think, and we need to replace some more volume.
Thank you. If Chris loses any more blood, he's at risk of organ failure.
OK, so bring 2 units of blood up and 2 FFPs, please.
Khalid makes an urgent request for donor blood.
Remember that for a moment? We'll put that up again a bit later. Put 2 bloods in.
How long do you want to catch up?
Give me
20 minutes?
15, 20 minutes.
20
yeah.
minutes. 20 minutes.
Yeah.
Khalid pauses the operation.
Oh, wait, sweaty work, that bit. All right, OK.
The team will have to wait to see if Chris is strong enough for them to continue surgery.
I have halted operations. It's always a tough decision. The distress it causes can be immense.
It's just his mind set that that's it, I'm going in, I'm having the operation, and I'm going to get better. Oh gosh, it'd be marvellous. Really would. I've waited for so long for something to happen. Just hope and pray that this operation does everything that we are hoping for. He's suffered enough, and enough is enough.
You found the abdominal wall yet, or no?
No, not quite. Under normal circumstances, we wouldn't have had to go so deep.
In Theatre 19, Judy's apron is so large that Sunil and his team are struggling to locate her abdominal wall, the point at which they can safely detach the maximum amount of tissue.
Because Judy's anatomy was so altered with the dragging of this abdominal apron, we found it quite difficult to find the abdominal wall. I think let's infiltrate the lower incision. We know where we are here. Yeah?
Sunil now wants to start cutting from underneath the apron.
I think that should be it.
But that means lifting a weight of over 30 kilos onto Judy's chest.
Raj, are you okay if we were to lift for a little bit? Be about 15 minutes. If we are causing you any respiratory problem, will you tell us? Whenever you're ready, so just tuck all this in.
The biggest concern was her ventilation. When Mr. Thomas moved the abdomen onto the chest, her airway pressures went really high.
Knife to me, please.
And one for me as well, please. Forceps.
Forceps. Okay.
The worst case scenario would be she's not able to oxygenate her organs, and that can have effect on the heart itself, and it can stop.
We just come out laterally, so to say.
You all right?
Have you?
Yeah.
Judy's heart and lungs are coping with the pressure, but the longer the apron is on her chest, the greater the chance of complications.
Raj, are you all right on your side?
Hemoglobin, everything is fine. Blood pressure is stable. Nothing to worry so far.
Sunil and Suk must work quickly to cut the remaining tissue.
Okay. So that's the belly button there, the long funnel-shaped stalk. I don't think this is reducible, so it's adherent.
In a regular apronectomy, the patient would be able to keep their belly button.
Can I have a stilly scissors, please?
Judy's umbilical stalk has become so distended, it can't be saved.
You'd never see such a thing, but I think in her case, with time, this has happened.
Okay, on your bed or
those staples are on the midline.
Only two major obstacles now remain. The large blood vessels from the CT scan that run from Judy's abdomen into her apron.
There's a place in surgery when you run and then when you walk. So this is a place where you need to walk slowly and carefully. So it's about 7 centimeters lateral to the midline. Can we get the Doppler? Because that big vein is over here.
The Doppler bounces high-frequency sound waves off blood cells, helping Sunil and Suk to locate the veins.
All right.
Here we are.
Yeah, there it is. There it is. Let's deal with the vein now. Come.
Okay. Huge amount of blood, so it will.
Okay. Put a Liger clip on.
The veins run through the apron tissue and must be severed with great care.
If we inadvertently damage one of these vessels, we would need to control the bleeding within seconds.
Yeah.
Another one there.
This is the biggest.
A large bleed could be life-threatening. We're nearly there, aren't we?
Yeah. You want to carry on there, and we'll do the same. I don't know if that's a vein or not. Anyway.
The blood vessels have been safely cut and tied off.
Ties, please.
The team is ready to make the final incisions that will separate the apron from Judy's body.
Having that thing removed from her will change Judy's life in a way that I don't think she knows herself. It's like somebody pressing the reset button. I still have feelings, I suppose. I would love to see her now that thing's removed.
1, 2.
It's quite humbling to have a significant impact on the person you're operating on. But then there's a different dimension to it as well. Scissors, please. One of my senior colleagues used to tell me that a surgeon operates, but it is God above who heals.
She's been so far behind.
You can take the apron down.
Yeah. That's it. Goodness me.
Just hold the top.
There's a sense of euphoria almost in theatre because we've all focused together to get rid of this tissue and finally we've removed it.
This is like a sack of, the rice we buy in the...
Because it's not part of Judy anymore, it could be on a film set. It's almost surreal.
It feels a big relief once you have done the physical part of excising and removing the abdominal apron and it's come off. But then the bigger challenge is the patient heals well, that we're able to close the tummy properly and make sure that she doesn't get any wound problems. That's the vertical dimension and that's the horizontal dimension of the defect.
The large wound in Judy's abdomen will need extensive surgery to repair.
What we need to do is delineate where we're going to suture. Can I have that pen again? I'll just do that for you. So that's the midline there.
Okay.
Layers of thin connective tissue that protect Judy's internal organs and muscles must be carefully stitched together. It's a slow and painstaking task.
Yeah, if you could. So it's Liz, yeah? We just tell her that if she could pick up the kids, please.
Okay.
Thanks a lot.
The team have been in theatre for over 4.5 hours.
I think I should end it off here now. So let's come together, all right? I don't think there's too much tension there. So thank you, everyone.
it's all done. Thank you very much.
Thank you.
What's the weight? What's the weight? How much?
I was 28. Yay!
The liquid inside the apron has drained away. When Judy was later weighed, she had lost 47 kilos, 7.5 stone.
The apron weighed the equivalent of a small person, I think.
It's going to be life-changing.
Yeah. Okay, ready, steady, slide.
Judy has so far handled the rigours of surgery, but with the added risks of her size, Raj wants to wake her immediately.
14023.
Nice big deep breaths, Judy. All right, okay, we'll take this out. She can have clots in her legs purely because she's not able to mobilize herself, and also because she's not able to breathe properly immediately after the surgery. She's at high risk of developing chest infection. It's all done. You're just waking up, all right? Remember, you're having an operation, it's all done. Every person is so different when they wake up. Sometimes they do have a good dream, and I've had thumbs up in the past, and sometimes they cry, and sometimes, they can scream and shout as well.
Someone's at the door. Someone's at the door?
Yeah.
Okay, we'll have a look at that in a minute.
Oh, I'm tired.
Dave, is he on the ward, do you know?
Oh,
I'm feeling nervous, feeling a little bit frightened. Oh, I really don't know what to expect. Everything's praying that Judy's going to be okay. It's a huge thing and not to be taken lightly. Hello? 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 How are you? Look at you. Yeah, I've been running. Yes, you're going to be.
If anyone asks me whether Judy's apron will return, it sort of sends a cold chill down my spine, because I think we've invested a lot in this. And really, this should not happen again, because it's entirely up to Judy to control her diet.
Hi, sir. Thank you so much for your help.
It's okay.
Obliged.
Very good, very good. Went very well.
Okay. There's some samosas. We always have samosas when there's a big case. The thing with samosas is, nobody ever complains. They're all happy with it.
As long as no one else has eaten them by the time the staff finish. I think we need to let's put another blood in, and then we'll get going.
In Theatre 20, surgery on Chris's spine is about to resume. Khaled has given Chris a blood transfusion and is now confident that he's strong enough to make it through the most dangerous part of surgery.
So what are you going to do now? Take out part of L5.
L5.
And make him bleed. This is the bit we expect to bleed.
Oh, okay.
Yeah.
Not that first bit.
The L5 vertebra is the lowest moving vertebra in the spinal column. Supporting the weight of the upper body, it's where Chris's spine is most out of line. Removing a 30-degree wedge of bone at the L5 will break his spine. But this dramatic act is the key to reshaping Chris's spinal column.
Someone was to say that back to me, that I'm going to break your spine and reset it, it would be pretty far-fetched and out there, and would be hard to believe. But these are things that we can do.
Start cutting the bone at the front. The spine will get weaker, and there's a risk of it obviously fracturing through.
Damage to the spinal cord at this point could result in paralysis from the waist down.
Mallet, please.
Delicate adjustment.
Coventry screwdriver.
People would think the spinal surgery is very delicate, microsurgery, don't move, you might catch a nerve. And people would be sort of slightly surprised when we get hammers and chisels out.
This is a brutal assault on the body. Things can go wrong despite best precautions. We might do the best surgery technically and everything's gone well, but still the patient wakes up with some problem.
I also think that looks a bit like a pneumatic drill.
And this is the nature of what we do, and it took a while for me as a junior neurosurgical trainee to get my head around that. But I got to a point, I think, over the years of being able to put that into a compartment in my brain somewhere and not let it overtake my decision-making process.
There's bits of bone in your bowl that we can keep.
Fragments of bone removed from the vertebra are kept, as they'll be needed later in the operation.
So use two of these in parallel, don't we? And then we can control the way that we close that gap by compressing together, sorry.
So Lucas?
Navin and Mel attach clamps to the vertebrae either side of the wedge they've removed. The clamps will be gradually tightened, closing the gap and slowly realigning Chris's spine into a more natural curved shape, so he will be able to stand up straight again.
I'll just compress a bit more on my side.
Yeah. We're doing more compress on your side actually as well, just asymmetrically.
Little by little, Navin and Mel are reshaping Chris's spine.
I'm probably not one to show stress. I guess psychologists say that's a bad thing. You're meant to express your stress, aren't you, in some way, shape or form, to have less of an impact on your own body. And maybe I'll see that in years to come.
We'll just check how far we're at the front. Can we have X-ray in? See that? So that's your side there. I think we could probably go a bit more at the front there.
I think we can see that the gap down there has closed.
I mean, that's absolutely spot on there, isn't it?
Yeah, that's not so bad. Okay, that's as best as we're going to get it, I think.
Before final adjustments to the spine can be made, the team must build the remaining fixtures that will secure the spine in its new position. It's a crucial part of the operation. The titanium rods will have to be shaped with precision so that they fix into every single screw head in Chris's realigned spine.
So just to confirm, 6mm titanium rod.
Okay, it's good. Yeah, just add a bit more curve at the top end. Yeah.
Usually, the surgeons have to rely on trial and error to shape the rods to the contours of their patient's newly curved spine. But the Queen Elizabeth is using Chris's surgery to test the latest computer technology.
Into the screw head is actually the computer's registering its relative position.
Yeah, go for it.
An infrared camera with 5 lenses maps the exact location of each screw head. A computer then calculates the contour of each rod.
Yeah, just made the lordosis and the lumbar spine, and then the top bit will come back to the rod.
You see, you've got your curve there.
Yeah.
The computer has generated a design that the team can use to create perfectly shaped rods.
So you worry about angles, aren't you?
For this case, all about the angles.
Number
4.
56.
56.
The accuracy of the technology increases the chances of a successful outcome to Chris's operation.
Changes what we can do in surgery. It shows exactly what it's going to be like when he stands up. You can be confident that we've fixed it in such a way that this should hold, then that's a game changer.
Okay, let's try that and see.
Moment of truth.
This innovative technology should also deliver faster results, cutting expensive theatre time and reducing risks to the patient from long periods under anaesthetic.
That was a good rod bender.
Awesome, look. Amazing.
Okay, good.
If I can introduce technology that's going to be a benefit, that's for me, that's the ultimate aim. And what we might offer now might not be what we offer in 20, 30 years' time.
Once the rods have been bent into shape and fixed to the screw heads,
Can I have a blocker?
Navin and Mel can tighten the screws making the final crucial adjustments to the shape of Chris's spine.
The most dangerous part of the operation is when we put the rods onto the screws, tighten them down, and that changes the shape of the spine. You can go for too much correction, you can try and straighten it too much. Sometimes it can leave patients worse off. The old phrase, the enemy of good is perfection, applies brilliantly to spinal surgery.
Can the table go up, please?
Don't go for an extra 5 or 10%. You've got what you need, get out.
Osteotome.
The screws and rods are susceptible to metal fatigue.
Osteotome. And a hammer.
To strengthen Chris's rebuilt spine and last him into old age, Navin and Mel will also do a bone graft.
Let's have the introthic.
Mel takes advantage of the body's natural healing process by deliberately distressing the vertebrae to stimulate new bone growth around the metalwork.
If you think about it, your arm bone is biologically relatively inactive until you break it. Because you disrupt the surface of the bone, and the bone sort of switches on. And we're doing exactly the same with this bone. We're roughening the surface to switch the bone on. Okay. We got the rest of that bone that we took out.
Fragments of the removed vertebrae are also packed around the spine and metalwork. Over the coming months, these fragments will grow and fuse together, creating one solid structure of bone and titanium. Chris won't be able to bend his back again. With time, he should be able to stand and walk upright with less pain.
Can I have the needles thingy me, Bob?
As opposed to an Ujimi flip.
After more than 8 hours of surgery, all that's left to do is stitch Chris up.
Kelly, what are his numbers looking like?
They're better. There's possibility he might need a bit more blood.
How many has he had
his
now?
total, he's had 10 units of blood.
10, oh shit.
Probably bled more than the average, I think.
He definitely bled more than me.
I feel like I've worked hard.
You have, Khaled, and it's much appreciated.
This case was at the top end of challenging in terms of the surgical exposure that was taking place. So, got anything more like this lined up in the near future?
Oh, yes.
I'll book my leave. And I was outnumbered. There's 2 surgeons and 1 anaesthetist.
Oh, dear. What a day. It's a tough one. You feel like having a drink at the end of the day, and you've earned it because it is a tiring day. So you can actually see here he's got a curve in his lower back. So that suggests that we've done something to give him a curve back.
I hope so after all that.
We feel relief that things have gone well. Feel that we've achieved the best that we can for Chris. And then your stress levels drop off a bit because what subsequently happens after that is out of your control.
I may excuse now if I've done everything I need to do. Thank you. Coffee. Food.
It's such a privilege working inside the body. It really is. Don't ever take the trust the patient puts in you for granted. They put their quality of life in your hands.
Six weeks after her operation, Judy is back at the Queen Elizabeth for a consultation with Sunil.
Mr. Thomas is on his way.
Okay.
So we're just going to
No
get
problem.
Hi. How are you keeping?
Yeah, I'm fine.
Good.
I'm feeling a lot better.
Up and about? And...
I'm up and about and then doing my exercise and going out for a little walk outside.
In the future, Judy would be able to manage a lot of things on her own. And I think in terms of providing care for this person from the district nurses, maintaining her hygiene, moving her around, getting a wheelchair or getting an ambulance, that is more cost to the NHS.
I couldn't ask for a better surgeon.
Okay.
Thank you very much, sir.
So I think the government has been helped financially with her operation.
To go from there to here, it's just amazing. I feel more happy in myself. I feel like a new woman. I just feel like, honestly, a new woman.
The operation has been deemed such a success that Judy has had further funding approved for a gastric bypass, a procedure that was previously impossible with an apron of her size.
I'm sure this is a new beginning for Judy in terms of self-esteem. And I'm really very privileged that I was able to be a part of this process of helping to improve this patient's quality of life.
Eight weeks after his surgery, Chris is back to meet with Navin.
Right, nice to see you again.
Yes, yes.
Hi, how are you? You okay?
I'm not too bad, thank you.
Okay, you grab a seat there for me. Right, do you want to come and walk over here? And you're using a frame at the moment?
I've just moved to a stick.
Oh, just a stick,
I've been around
okay.
the house,
Yeah.
holding on to things
Okay.
since yesterday afternoon.
Yeah.
Everyone has their own goals and what they want to achieve in life. And I think in Chris's case, if you didn't offer surgery, then his options are very limited.
Okay, so see how you're balanced there?
Yes.
Yeah, in terms of your head being over your pelvis, this is much improved to what you were before.
Much.
In terms of the parameters that for what we've corrected, it's spot on. It's what we wanted to achieve. But persevere, it will be hard work. And think about the long game, because that's where we need to be reviewing things at 18 months, 12 to 18 months down the line here.
Thank you very much.
No problem. Nice to see you again, Chris.
Thank you.
Okay. I'll put you across, don't worry.
Thank you so
Yeah,
much.
no problem, that's okay.
I think it was the right decision to offer Chris surgery. He's only just started his rehabilitation process, and that's going to be a long road for him. I'm optimistic that he's able to stand upright and less pain. I have seen a change in his hope.
I feel very optimistic about the future. He's done his part of the job. He's straightened me up and squared me off, shall we say. So now it's just about me doing everything I can.
Chris is making a mess with all the furniture, bang, crash, wallop. And I'm being the waitress. Unpaid, by the way. But saying that, this week he has booked up to make both of us realise you're only here for a short time. So make the most of it. And we're going to. First thing, once he's really sorted, is a nice holiday. Don't know where yet, but find somewhere.